You probably walked into your doctor's office thinking, this is just another routine checkup, nothing serious, nothing to worry about. And then your doctor says something like, let's schedule a few screenings, just to be safe. And you nod. Of course you do. Because that is what we have all been taught, right? More tests means you are being careful. More tests means you are protecting your health. But what if I told you that after a certain age, some of those routine tests are not actually helping you anymore? In fact, some of them might quietly be putting you at risk. I know that sounds uncomfortable, maybe even a little shocking, because this goes against everything most people believe about healthcare. But after more than 30 years working with older adults, I have seen something that most people never get told. I have seen patients walk into a screening feeling perfectly fine and walk out weeks later dealing with problems they never had before. Not because the doctor made a mistake, not because something went wrong, but because the system kept going, even when it should have stopped. My name is Dr. Daniel Hargrove. I have spent my career in internal medicine, focusing on patients over 60. And today, I want to share something that might completely change how you look at routine screenings after 70. There are a handful of very common tests that I personally would think twice about, or even avoid once someone reaches that stage of life. Not because medicine is bad, not because prevention does not matter, but because the rules change. And almost nobody explains that part clearly. Before we talk about the actual tests, you need to understand one idea first, because once you get this, everything else will start to make sense. Think of every medical test like a balance. On one side, you have the potential benefit. On the other side, you have the risk. When you are younger, that balance is usually in your favor. Let's say you are around 50. If a screening finds something early, you still have decades ahead of you. There is time to treat it, recover, and actually benefit from catching it early. So the trade-off makes sense. But after 70, three things start to shift, and this is where most people get caught off guard. First, the way diseases behave changes. A lot of conditions, especially certain cancers, grow very slowly in older adults. So slowly that they may never actually cause symptoms during your lifetime. In other words, you could have something and never even know it, and it would never harm you. You would live with it, not die from it. Second, your body is not the same as it was 20 years ago. And that is not a bad thing, it is just reality. Procedures that used to feel simple now carry more weight. Sedation hits harder. Recovery takes longer. Complications become more likely, even from things that used to seem routine. And then there is the third piece. This is the one that worries me the most. It is something called the cascade effect. Here is how it works. You go in for a simple test. That test finds something small, maybe something that does not even matter. But now that it has been found, it cannot be ignored. So your doctor orders another test. That leads to a more detailed scan. Then maybe a biopsy. Then a procedure. And before you know it, you are in a cycle that just keeps going. Each step feels logical on its own, but together, they can lead you somewhere you never needed to go in the first place. I have seen this happen more times than I can count. People who were active, independent, feeling good, suddenly dealing with hospital stays, side effects, and complications, all starting from one routine screening. That is not prevention anymore. That is harm, disguised as caution. And the hardest part? Most patients never realize this is happening until they are already deep into it. So today, I want to slow things down. I want to walk you through several common tests that sound harmless, even responsible, but after 70 deserve a much closer look. Not so you become afraid, but so you become aware. Because once you understand how this works, you start asking better questions. And better questions can protect you more than any test ever could. Let's start with one of the most common screenings people are told to keep doing, even into their late 70s. And it might surprise you. We are talking about routine colonoscopy. Now, before you misunderstand me, colonoscopy can absolutely be life-saving for the right person, at the right time. But after 75, the equation starts to change. Let me tell you about someone I will never forget. Her name was Margaret. She was 78, sharp mind, independent, the kind of person who still walked every morning like clockwork. She felt completely fine, no symptoms, no complaints. But during a routine visit, Her doctor told her she was due for another colonoscopy. She hesitated. Something in her gut told her she did not need it. But, like most people, she trusted the recommendation, so she agreed. What happened next had nothing to do with cancer. It started with the preparation. If you have ever had a colonoscopy, you know the prep is not easy. For someone her age, it hit much harder than expected. She became severely dehydrated. Her electrolytes dropped. Her heart rhythm became unstable. And before the procedure even happened, she ended up in the emergency room. Think about that for a second. She walked into that situation feeling perfectly healthy, and before the actual test even began, she was already in danger. This is the part people do not talk about enough. It is not just the procedure itself, it is everything around it. And in older adults, those risks add up quickly. Because after 75, the chances of a colonoscopy finding something that would actually change your life become smaller. But the risks? They go up. The risk of tearing the bowel, the risk of complications from sedation, the risk of dehydration from the preparation. All of these become more significant. And here is the key point most people miss. Even if something is found, it does not always mean it needed to be found. Some growths, some abnormalities would never have caused a problem. But once they are discovered, they set off that cascade we talked about earlier. More tests, more procedures, more risk, all starting from something that might have stayed silent forever. So if someone is over 75, feeling fine, no symptoms, no strong family history, and previous screenings were normal, it is worth asking a simple question. Do I really need to go through this again? Or is there a safer, less invasive way to keep an eye on things? Because sometimes doing less is actually the smarter move. And that idea is going to come up again as we go deeper into the next test. But what I am about to tell you next is even more controversial because it involves cancer screening, and almost nobody is willing to question that. If you think what we just talked about was surprising, the next part might completely change how you see it. Now, this next one is where things usually get uncomfortable, because the moment people hear the word cancer, everything changes. Fear takes over, and the natural reaction is simple. Check everything as often as possible. Catch it early at all costs. And I understand that completely. But here is the part most people are never told. More screening does not always mean better outcomes, especially in your late 70s and 80s. Let's talk about aggressive cancer screening, specifically for breast cancer in women and prostate cancer in men. Now listen carefully, because this is important. I am not saying cancer screening is useless. I am saying that at a certain age, it can lead to something called overdiagnosis. And overdiagnosis leads to overtreatment. Let me explain what that really means. In plain terms, imagine a test finds a cancer. That sounds serious. But what if that cancer is growing so slowly that it would never actually affect your life? It would never cause symptoms. It would never shorten your lifespan. It would just exist quietly. But the moment the word cancer shows up on a report, everything changes. No one wants to leave cancer alone. So the process begins. First comes the biopsy, then surgery, then possibly radiation or medication. Each step comes with its own risks, and for an older body, those risks can be heavy. Fatigue that does not go away, loss of strength, infections, long recovery times, sometimes permanent side effects, all for something that might never have caused harm in the first place. This is not a theory. We see this in real data. In older women, a significant number of breast cancers found through routine screening are what we call slow-growing or inactive. They are not aggressive. They are not life-threatening. But they are still treated, because once they are found, it is very hard to ignore them. Now let's talk about prostate cancer. This one is even more complicated, because as men get older, it is extremely common for certain markers to rise naturally. There is a test called PSA. It is often used to screen for prostate issues. But here is the problem. PSA levels can go up for many reasons, not just cancer. Age alone can push that number higher. But once it is elevated, it triggers concern. And that concern leads to the next step, a biopsy. Now, biopsies are not harmless. They carry a risk of infection, and in some cases, that infection can become serious enough to require hospitalization. But let's say the biopsy finds cancer. Again, that sounds alarming, but in many older men, that cancer is slow growing. So slow that it would likely never cause a problem. But now, a decision has to be made. Do nothing or treat it. And most people choose treatment, surgery, radiation. And here is where things get real, because those treatments can change your life permanently. Loss of bladder control, loss of sexual function, chronic discomfort. For a cancer that might never have affected you. I remember a patient named Gerald. He was 81, a retired teacher, sharp, thoughtful, still enjoying his life. He went in for a routine check. His PSA was slightly elevated, nothing dramatic, but it was enough to trigger a biopsy. The biopsy found a low-grade cancer, not aggressive, not urgent, but once it was there, it felt impossible to ignore. His specialist recommended surgery, and Gerald agreed. 6 months later, he came back to see me. He looked different, tired, frustrated. He told me he now needed to wear protective pads every day, and the thing he said next stayed with me. He said, "If I could go back, I would have never taken that test, because the cancer itself was never the problem. The treatment was." That is the reality most people never hear. So if you are over 75 and your doctor suggests cancer screening, there is one question that becomes incredibly important. If this test finds something, what will we actually do about it? And more importantly, will that treatment improve my life or just create more stress, more procedures, and more risk? Because not every cancer needs to be chased, and not every finding needs to be fixed. Now let's move to another test that sounds completely harmless, even responsible. Checking your heart. Routine cardiac stress testing. You have probably heard this before. Let's just make sure your heart is doing okay. It sounds reasonable. You either walk on a treadmill or receive medication that mimics exercise. They monitor your heart, check for any signs of trouble. Simple, right? Here is where it gets tricky. In people who feel completely fine, no chest pain, no breathing issues, these tests can produce false alarms, and not just occasionally. In some cases, quite often. That means the test suggests there might be a problem when there actually is not. But once that suspicion is there, it leads to the next step, a more invasive procedure, something called a catheterization. This involves guiding a thin tube through a blood vessel all the way to your heart. It allows doctors to look for blockages. Now, this is a powerful tool when it is truly needed, but it is not risk-free. There can be bleeding, damage to blood vessels, in rare cases, even heart complications during the procedure itself. And here is something important. As we age, it is very common to have some degree of narrowing in the arteries. It is part of the natural aging process. So when doctors find a partial blockage, it can lead to another decision. Do we place a stent? And many times, that is exactly what happens. But large studies have shown something surprising. In people with stable heart conditions, placing a stent does not necessarily prevent heart attacks and does not always extend life compared to medication alone. So think about the path here. You felt fine. You did a routine test. That test raised a concern. That led to an invasive procedure, which led to treatment. And in the end, your outcome may not be any better than if you had simply continued with medication and healthy habits. But now you are dealing with additional risks. Blood-thinning medications, bleeding concerns, follow-up procedures, all from a test that may not have been necessary in the first place. This is why, in people without symptoms, routine stress testing can sometimes create problems instead of preventing them. And this is the pattern you are starting to see. It is not that the tests are bad. It is that the timing and the context matter more than most people realize. Now, in the final part, I'm going to share 2 more tests that sound logical but can lead to serious consequences. And more importantly, I'm going to give you a simple set of questions you can use at every doctor visit to protect yourself from unnecessary risk. Because once you have that, you are no longer just following instructions. You are making informed decisions. Now, let's talk about the last 2 tests. And these are tricky, because on the surface, they sound completely logical. In fact, most people would never question them. The first one is bone density scanning. You might have heard of it as a DEXA scan. The idea behind it seems simple. As we age, bones can become weaker. That increases the risk of fractures. So, checking bone density sounds like a smart preventative move. And in some cases, it is. But here is where things get complicated. The scan itself is not the real issue. It is what often comes after. When a scan shows low bone density, the typical next step is medication. Drugs designed to strengthen bones over time. And again, that sounds helpful. But long-term use of these medications can come with serious downsides. Some people develop unusual fractures in the thigh bone, the very thing the medication is supposed to prevent. Others experience problems with the jaw, a painful condition where the bone does not heal properly after dental work. These are not common, but they are real. And in older adults, even a small risk can become significant. But here is the part that almost nobody emphasizes enough. The most effective way to prevent fractures in older adults is not medication. It is preventing falls. Think about that. Most serious fractures happen because of a fall, not just weak bones. So instead of focusing only on bone density numbers, it may be far more powerful to focus on balance, strength, and environment. Simple things. Improving stability through gentle exercise. Making sure your home is safe. Removing loose rugs, adding support bars where needed, checking your vision, reviewing medications that might cause dizziness. These steps can reduce the risk of falling dramatically, and they come with zero side effects. So, if you are being offered a routine bone density scan, and you have never had a fracture, it is worth asking, what will we actually do with this information? And is there a safer, more practical way to reduce my risk? Because sometimes, the simplest solutions are also the most effective. Now, let's move to the final test. And this one might sound like the smartest of all. Checking the blood flow to your brain. This is done through something called a carotid artery ultrasound. It looks for narrowing in the arteries in your neck, the ones that supply blood to your brain. The logic seems obvious. If you find a blockage, you fix it, and you prevent a stroke, right? That is what most people assume. But here is where reality becomes uncomfortable. In people who have no symptoms, no warning signs, no history of stroke, finding a blockage does not always mean you should fix it. Because the procedure used to fix it carries its own risks. There is a surgery where doctors remove the buildup from the artery. It is called a carotid procedure. And while it can be helpful in certain situations, it is not risk-free. In fact, in some cases, the procedure itself can trigger the very thing it is trying to prevent, a stroke. Let that sink in. You go in to prevent a stroke, and the intervention causes one. The risk may sound small on paper, but in older adults, that risk increases. And when it happens, the consequences can be life-changing. I remember a family who called me about their father. His name was Robert, 79 years old, still independent, still active. He had a routine screening, no symptoms at all. They found a blockage in his neck. It sounded serious, so he was referred for surgery. The goal was prevention, but during the procedure, something went wrong. Robert had a stroke. He survived, but his life was never the same. He lost the ability to speak clearly. He needed help with daily tasks. And the hardest part? The blockage that was treated had likely been there for years, without ever causing a problem. That is the kind of outcome no one expects, but it happens. And this is why, in people without symptoms, routine screening of these arteries is often not recommended, because the harm can outweigh the benefit. Now, I know this is a lot to take in, and you might be wondering, so what should I do instead? How do I know when a test is worth it and when it is not? This is where everything becomes very simple. I want you to remember 4 questions, just 4. You do not need to memorize medical terms. You do not need to argue with your doctor. You just need to ask these questions, calmly and clearly, every time a new test is suggested. Question 1. What exactly are we looking for with this test? And what happens if we find it? Question 2. If something is found, what would the treatment be? And what are the risks of that treatment for someone my age? Question 3. What happens if I choose not to do this test right now? What is the real risk of waiting or doing nothing? And question 4. Is there a simpler, less invasive way to get useful information without the same level of risk? That is it. These 4 questions can change everything, because the right doctor will not be bothered by them. In fact, a good doctor will welcome them. They will take the time to explain. They will help you understand your options. And if they do not, that tells you something important too. Now let me be very clear, because this matters. This is not about avoiding healthcare. This is not about ignoring symptoms. If something feels wrong, if you have pain, bleeding, sudden changes, you absolutely need to get checked. Symptoms change the equation completely. What we are talking about here is routine screening, the kind where you feel perfectly fine, but a test is suggested just to be safe. Because after 70, safe does not always mean what you think it means. For years, I have watched patients walk into these situations feeling healthy and come out dealing with complications they never expected. Not because anyone made a mistake, but because no one stopped to ask, is this actually helping? You have every right to ask that question. You have every right to understand the risks. You have every right to say, not right now, or even, no. This is your body, your life, your decision. And sometimes, the best way to protect your health is not by doing more, but by choosing carefully what truly matters. If this opened your eyes in any way, I would really appreciate it if you stayed connected, because I share insights like this every week to help you make smarter, safer decisions as you get older. And I'm curious, have you ever had a test that led to more problems than you expected? If you are comfortable, share your story. You never know who it might help. I will see you in the next one.